Very nice. All right, folks, did you know that calling 911 from a cell phone is a big mistake?
Well, ER doctors and nurses do, and you should too. In fact, there are a ton of mistakes that patients make every single day. It's our fault. Erin Tolbert is an ER nurse practitioner, and she's here to blame all of us for our mistakes. Nice to see you this morning.
Good to see you.
So all right, don't call 911. Most of us have cell phones now. A lot of people don't even have landlines anymore.
Right. If you have the option, obviously if there's an emergency, call 911 from your cell phone if that's the only option available. But it takes at least 25 seconds for the dispatcher to locate your location when you call from a cell phone, as opposed to a landline. That address pops right up on the screen.
Really?
There's also like some fuzziness around this. If you're in a concrete building, if you're in a congested area like New York City, it can be a little bit difficult to locate the cell phone as well. So if you have the option, call from a landline.
Okay, another thing you say is that half of people drive themselves to the hospital when they're exhibiting signs of heart attack or stroke, which is also a big no-no.
Yes, you would be amazed the number of people I see working in the ER who drive themselves to the hospital with chest pain, stroke symptoms, gunshot wounds even. Call 911.
Let's be honest, most of these people are men. Am I right?
That's true. That's true. Men are much more likely to do this. But the problem is, not only is it dangerous for others on the road, but also you can get your treatment started earlier when you call 911. Right next to my desk where I work in the ER, the paramedics have access to one of our printers. They can get me a copy of your EKG so I can know, do we need a cardiologist on hand when you arrive? Is there a room for you? So get your treatment started earlier. Call 911.
One big thing you say is don't wait out stroke symptoms. And my father had gone through this a couple of years ago, and it is frightening. If he had waited it out, he might not be alive.
Yes, exactly. I work at a stroke center, and I see patients who wait too long all the time. We have about a 3-hour window to treat most types of strokes. There are certain medications we can only use within a few hours of that initial symptom onset. So if you get a sudden headache, numbness, weakness to one side of the body, especially loss of coordination, get to the emergency department right away. You'll have a better long-term outcome.
So often we spend more time in the waiting room than we do actually seeing the physician.
Right.
So this next one can be hard. But if your doctor is giving you some sort of instructions that you don't understand, you say we need to speak up.
Yes, about 78% of people leave the hospital without understanding what they're supposed to do when they get home. This is the most important part, at-home treatment. We get everything started at the hospital, but it's up to you to take the medications appropriately. So, A, ask questions. Make sure you understand what you're supposed to do. And B, take those printed out instructions with you. Don't toss them in the trash as you're leaving, going out the door. Another thing you can do is also bring a friend or a family member with you to listen to the instructions. 2 sets of ears, always better than one. Call back if you don't understand something. We're happy to re-explain it. Even if that doctor who treated you isn't there, somebody else can likely tell you what you're supposed to do.
78% seems high.
Yeah.
That's pretty high.
Yeah.
All right, Erin Tolbert, great to see you this morning.
Good to see you.